Dr. Taggart, in your list of questions you see from patients, I see one of your major concerns they seem to have is saying that they went to a doctor and they didn't get a chance to ask them all the questions that they had for them, or that the doctor or clinician seemed very stressed or busy or didn't have the time for them. Why do you believe that's being more of a concern of patients in today's world?
Well, it, how wonderful that a patient is that kind and thoughtful that they don't want to bother that they're concerned about bothering the doc or that the doc is busy. Um, don't be that wonderful. Don't be that nice. Is my first thing that I want to say here. Um, is that doc who is your doc who was just in the room with you moments ago um, uh, i- is almost certainly a well-trained doc who went through a long uh, uh, tunnel of of uh, great effort and struggle and stress called medical school and internship and residency training to get where they are, and you don't get through. My point is, you don't get through that tunnel without having a real commitment to do the right thing for patients. And so that doc almost certainly would feel really bad if they looked so busy or sent the wrong body language message in some way that made you think that they're not available for your question. Um, and they're also getting paid to answer your questions too. Um, so be assertive is my top advice here. Let me get to the part though, Adam, that you mentioned about, why do I see this happening more lately? And I do. Let me answer it this way. I'm going to describe to you how I've seen the practice of medicine change by describing the experience of a very close colleague of mine who I admire greatly. This is a great, committed, extremely caring doc who I'm going to describe to you. And so she started her medical practice a couple of decades ago, um, uh, where it would be routine for her to enter the room with a patient and say something like, "Hi, Mr. Johnson, how are you? Yes, we're going to get to your blood pressure, of course, and we're going to get to your cholesterol, and we'll discuss that. However, just let's take a step back. How's life? What's going on? And most importantly, what's important to you for us to talk about today?" And then it might easily happen that the discussion goes in a a very human direction, like the following, like, "Oh, Mr. Johnson, that's right. Your your daughter was getting married last month, right? How did that go? And oh, you're going to show me pictures. Great. Wow, she's beautiful. Um, how wonderful." So, um, the the human connection was something that this doc of this colleague of mine would just so admirably emphasize, and that's how we were all trained. That's really why really all the docs I know went into medicine to kind of have a relationship with the people who you're helping heal. And so here's what I've seen change, and that is that even great docs like this colleague of mine nowadays are going into the room, and what's in their head is, I don't have time to talk to Mr. Johnson about, "Hey, how's life? Hey, what would you like to talk about today?" Certainly, uh, there's no way we're going to get to look at his daughter's wedding pictures, because there are 13 different things that the system is giving me that the system is mandating that I go through with this patient. It's right here on my computer screen, and it says, for this legal reason, we have to talk about these two things, and for this regulatory reason, we have to talk about these three other things, and for this paperwork reason, we have to cover this other thing. And so um, this is all happening during an era when no doctor's time for appointments is going up. In fact, typically the amount of time for appointments is going down. So more is being added to the agenda that isn't stuff that's been added to the agenda by the patient or by the doc, but it's been added by the system. And so good docs like my colleague friend and so many others are unfortunately not adequately able to conceal that they are stressed and hurried and partially mentally attending to these other stresses that are not in the room with the patient and have nothing to do with that patient, well, have very little to do usually with that patient's needs. And so it my answer to your question is I see this more and more because of that, that the patient, is of course a perceptive human being and is going to pick up on a doc being somewhere else in their brain to some extent or stressed, particularly on a bad day. And I think that's sad. But, it's something that I encourage patients to not be deterred by and be assertive. Ask your question for your needs. I wanna say one more thing about this. Um, uh, Good, well-trained docs want patient questions, they want patient feedback, they rely on it. Otherwise, they're in danger of assuming that things are going fine when actually they may be needing feedback that could change the treatment course towards a better direction for the patient. A medicine change might be needed. There might be a side effect that the patient, God forbid, might be embarrassed to talk about or feeling that the doctor is too busy for them to bother them with it. That's crucial. That's a gauge on the dashboard that the doctor needs to be pointed out by the patient. And so any good practitioner is going to be really upset that they did not get important feedback from a patient, which can be in the form of a question very often, like, "Hey, doc, I'm wondering, is this a side effect that I'm feeling on this medicine?" Or "Hey, doc, what about this other thing?" These are things that affect the doctors, that these are things that help the doctor target treatment better. So again, I encourage you to, as a patient, to ask your questions. And I just thought of one more thing, Adam. Um, I think we all, myself included, are annoyed when practitioners are not running on time and we're there in the waiting room, reading 6-month-old or 2-year-old magazines. Um, and, uh, um, and so, I get that, I feel the same way. However, I'll say something that may surprise people. I would never want myself or a loved one or a friend to go to a doc or any health practitioner who was known for consistently running on time. I mean that because in my experience, 9 times out of 10, if a healthcare practitioner is running late, it's because they decided to choose compassion for the patient, or they decided to prioritize answering a question for the patient over the almighty clock. And that's a practitioner that you and your loved ones want to be with, not one who's known for always running like clockwork.
Dr. Taggart, hearing all of that, it can definitely be a situation where people have been in doctor's offices and we've all kind of asked questions or not asked questions that we wanted to. And, giving your summary, it kind of explains why they do what they do and some of the systemic things that may cause them to not have the same amount of time they'd like to or have had in the past, which many of us have experienced. It begs the question, what do you do different in your practice? And is that part of the reason you chose to do things your own way in your psychiatry practice?
Yeah, I would not represent in any way, Adam, that I'm any better than anybody else. But I just by not taking insurance, that allows me to, um, and by not being in a system, I'm my own system. I'm my own um, uh, business entity. I'm my own clinical entity. So really, it's happily back to the old days where it's just myself and the patient who is, or in the case of seeing a kid, it's myself and the child and their parents deciding what we talk about, what we prioritize to talk about, what how much time we take, um, and so to get into more of the granular aspects of your question, some of the things I'll do is, families, some families and I very commonly realize that, hey, you know what, half an hour appointments just don't seem to be enough for your for your needs, Mr. Smith. How about we just start scheduling hour long appointments? With some families, I'll schedule hour and a half or 2-hour long appointments because that seems to be what, um, they like best and what allows me the time to kind of get into all of the things that need talking about, need checking up on, um, without feeling like we're giving short shrift to anything. So, in other words, the clock has been, uh the clock as well as the agenda has all been decided upon just by the patient or their family and myself. And so it allows us to really reliably get everything talked about, get everything in. Now, sometimes, of course, things can come up where we don't have the time. Something some urgent issue came up for the patient, and that needed lots of time in the appointment, and or we just didn't have enough time to talk about it in in a complete way. And so the other way that I think I run my to answer your question, the other way that I believe I run my practice that helps helps remedy this problem that we described earlier is that again it's just me in my practice. So when a patient doesn't have when we realize we haven't had enough time in an appointment and I've need to see my next person, um, what I'll typically say to the person whose session is up and didn't get everything didn't get talked about is I'll say, "Well, Mr. Smith, here, let's just quickly look at my calendar. Oh, I have an open slot later in the day. Can you come back then? Or I have 2 open slots 2 days from now. How does that work?" Um, so they don't have to deal with a scheduling system. They don't have to, leave a voicemail or send emails back and forth with some scheduling person. They're just dealing with me to to schedule things. And so I believe that's simpler, and and of course the scheduling person, me, knows the urgency of their request, so I'm offering them appointments that, are as soon as possible. Um, so I think the other things that I do to try to remedy this, problem that we've described are also I say at the beginning of the appointment, as we were all trained to do as good docs, uh, "Hey, Mr. Smith, um, after you've caught me up on how things are, going in your life um, and, uh, um, and we've exchanged greetings, I'll very typically say, I believe reliably say, 'Hey, Mr. Smith, what are the top things you wanna be sure that we get to talk about today?'" So that kind of, establishes the agenda at the beginning, and I take note of that list and do my best to make sure we get those things talked about. So those are hopefully, I believe, remedies to this problem that I I think my patients would tell you work for us as a team.